Hello, hello! Welcome back to Little Help for Our Friends. Today we are talking about couples therapy. And this is going to be a two-part episode. So we'll do part one, which is sort of demystifying the experience. What is couples therapy? What isn't it? Maybe when should you seek it? And then next episode we'll talk more about kind of tips for how to be a stronger couple. So for this episode, Kibby and I both have personal experience having couples therapy, and Kibby also has experience doing couples therapy. So she has been a couples therapist. And so she can kind of walk us through common expectations that people have going into couples therapy. And again, like who it's for, what it's like, and we can both share our experiences. I also have some follower stories. So Kibby, start us out.
Yeah, I love couples therapy. I think it's just such an interesting area of psychology that a lot of people just come to couples therapy when things are super, super bad. Like when you're about to break up with someone, when something just feels like so abusive or problematic that you just need someone else to help you. So I think people come to couples therapy often when it's like dire situations, but I think the main message I want to get across today is that couples therapy can be helpful even when before those stages, even when there's just communication patterns that could be improved, or ways to help each other better through stress, or even just like before people get into like a bigger commitment like marriage or something. It's nice to have a couple of couples therapy sessions, just like talk through values and expectations and the way you actually go about achieving goals together. So I think it's just helpful, in general. But
well, yeah, to piggyback on that, I mean, the number one cliche I always hear from people about couples therapy is if you need couples therapy, it's already too late. And that's such a backwards way of thinking, but you can see how this happens if people do wait until it's too late to get couples therapy. If they wait until their relationship has already completely collapsed, the feelings are dead, there's been something that they can't move past, and they go to couples therapy as a last resort, then it's going to have a lower chance of being effective. And I feel like it's a similar attitude that people have to egg freezing. Like, if you wait until you're 38 and you don't have any eggs left, then egg freezing isn't going to work very well. But if you do it preemptively, while you're still healthy, while your eggs are still healthy, then you're going to have success.
Yeah, and it's really funny too, because we talk a lot about individual, not even individual, because we talk about psychopathology and mental health issues as being like a family system-wide thing. But with a couple, it really is like you and your partner only know what it's like to be in this relationship together, right? You talk about your sides with your friends and family and stuff like that, and they get kind of one picture, one slice of the whole picture, right? Like when that person pisses you off or something like that. But it's only you two know what it's actually like to be in this relationship together. It's like this little world that you create together. And couples therapy is like one of the few times that people invite someone else to see those intimate moments and the intimate dynamic. And there's a lot that could be learned from that. There could be a lot from having other eyes or another person in the room while you're going through your most intimate couple moments. So, I mean, in general, I've only done a little bit of training in couples therapy. I'd love to do more. But what I'll share kind of like what I've learned in terms of what is it? Like, what is couples therapy? Like, what is the approach and what's the goal? So first of all, couples therapy is, it treats the couple as the patient, right? Your relationship, the couple itself, the marriage, the coupleness is the actual patient. So a lot of people come into couples therapy thinking like, I just got to drag my husband to this thing so that someone else can tell him how much of a jerk he's being, right? Like a lot of people come in with their individual agenda of like wanting someone to tell your partner that you're right in the fights. And it's really not about that. A good couples therapist won't take sides and won't align with one person over the other. Only if that's a strategy to help the couple. So it's really about treating the relationship, right? So you're thinking of it that way, right? Like we're all a team that's working on this this marriage, this relationship, and improving it. And a lot of couples therapy is broken up into two phases, the like kind of assessment phase, where you kind of understand the couple itself and the patterns that we're dealing with and the problems, and then the intervention. So a lot of therapy is like that, assessing the problem and then approach to fix it. But I think at least the therapies that I've heard about, especially in the cognitive behavioral realm, it's all similar idea. It's the idea that the couple, a healthy couple, should be a team. Should be a collaborative team that navigates problems and stressors in life together in this collaborative way. And there's all sorts of communication patterns and emotions, thoughts, and behaviors, right? That are just like kind of cyclical patterns where one partner does their thing and then the other partner does their thing, their behaviors, and then they kind of interact, right? Like, so for example, one typical problematic pattern in couples is the demand withdraw pattern, where one partner demands something from the other, like asks something, wants more attention, wants them to do something, right? Like asks something of the other partner, but then that partner withdraws, like avoids and shuts down, right? And like pulls away from the relationship, and then the first partner keeps demanding. So this kind of like chase, right? This demand withdraw cycle. Or the opposite, where like both parties shut down and avoid each other, or both parties get mad and fight with each other, right? So there's all these different kinds of problematic patterns. And the point of like most evidence-based couples therapies is to analyze those patterns and figure them out and kind of really getting the scope of what's happening. And then try to work through thoughts, behaviors, and emotions, right? The way they communicate with each other, the way what they interpret and believe about the other person, how they feel in those moments, and work through and try to get like more healthy patterns so that the relationship is back on a team.
Yeah.
But of course, they're thinking about the relationship as the patient, right? You have to define like, what is the goal? What is the overarching goal of the therapy? Is it to learn how to stay together and work through issues? Is it about trying to figure out if you're trying to stay together or not? Or is it about breaking up and separating in healthy ways that's more amicable and collaborative and maybe like it's better for the kids or something like that? So thinking about that when you go into couples therapy, about like what do you two want for the relationship? And that's gotta be you gotta agree upon that, right? You can't have two different ones. Otherwise, couples therapy is really challenging. If one person wants to break up, but keeps it a secret, and the other person like wants to, reconnect and reunite.
How do you handle it as a therapist? I mean, it's funny because you said the woman might come in and be secretly thinking, finally someone can see that he's an asshole. We'll validate that and we'll point it out to him. And you can't, as a therapist, take that stance. But what happens when that is kind of what you're thinking too? Like, wow, this guy's kind of an asshole. And one person's the problem here.
Yeah, and I totally get that, because a lot of people come into therapy from this place of loneliness. And maybe that's just the way I felt, especially, but where you feel like you're fighting against this constant conflict, or your partner or something, and you feel like no one sees you, especially the partner, like no one sees your side. You feel alone. You want someone to help you and someone to support you in the relationship, right? Not just like venting to your friends, but like someone to be on your side. So like I totally understand that and have felt that myself. But the way couples therapists go around that is that they will have this assessment period. Well, they'll talk about to the couple and like, tell me about how you met. Tell me what draws you together. Like, try to get the strengths. Like, how do you, what do you like about that other person? What do you value? And then what do you guys want for the relationship, right? And so they might say something, but then the other piece of assessment, often, at least the way I learned, is that you have separate sessions with each party individually, right? Again, in keeping in mind that the relationship is the patient, but you're talking to that person about the relationship, right? And maybe things that they might not feel comfortable saying in front of the other person, but with the understanding that you will eventually share it. So if someone goes, I have an affair, you have to be on board with talking about it, or at least ending it, or doing something that is like in service of the relationship, because holding that kind of secret will eventually destroy it, right? So, yeah, so it's complicated.
So just to give kind of a clear overview of couples therapy, this is from a paper on cognitive behavioral couples therapy, and it's a paper by Fisher, Balcom, and Cohen, and they say that the 5 aims of couples therapy is 1, to alter the couple's view of their difficulties to be more dyadic rather than individually based, which I think is great. Reading this, it just sort of, even though I kind of already knew this, it clarified something for me, because especially, I mean, for one thing, like I was forever single until Paul, and you can get so stuck in seeing your problems as your individual problems, or that's him over there, that's his baggage, and to see it, no, actually, like, we're a team, and these are problems that affect both of us, and these problems are a function of like how we work together instead of so individually based is a cool way of looking at it. Number 2, to decrease maladaptive emotion-driven behavior. Number 3, to draw out vulnerable emotion-based behaviors that might be adaptive for partners to share. This actually happened between Paul and me this weekend. 4, to increase constructive communication patterns. And to emphasize the couple's strengths. So I think that's it's kind of like, it's almost bookended by like strengthening the couple, like having them view themselves as a team, and then those middle prongs were how to actually strengthen, like how to sort of skills-based strengthen what's going on in the relationship. If you see a pattern that's clearly being driven by some kind of underlying like emotional process that isn't being shared or might not be explicitly known about, then you kind of reveal that and try to work on increasing communication patterns and increase sort of wise mind ways of approaching problems. So yeah.
I think it's cool because it's kind of all the stuff that we love, not just looking at the individual, but looking at how all these things interact with people around you, right? Like I come in with my baggage, my partners come in with their baggage, and it's like how when they mix and interact, like it creates something new, right? Mm-hmm. And there are, if you look back on all your relationships, you probably see some patterns, but it's just like this unique combination, an emergent property of 2 people bringing all their stuff together and then working through something stressful or asking for love from each other and showing love to each other.
Okay, so Kibby, you have experience being a couples therapist. What, in these kind of 5 prongs, like, have you seen these in your work, and how have you addressed them?
Yeah, I've been lucky that most of my experience has been with couples who were on board with making it a team, because I've heard like a lot of my colleagues kind of working with couples who are on those very different pages and think individually. So even just starting out as a team and saying, we want to work on this is just so helpful. It's like a huge foundation. And here's, the common example is that that I can think about from my work is that when one partner gets really, really upset and really stressed out, then the other person tries to help and tries to do what he or she thinks is helpful. Like, one of my kind of the typical examples, like the one partner tries to problem solve and give them advice and tell them, it's fine. We're going to be fine. You're wrong in the way of thinking about it, that it's, it's not that stressful. We could just do the X, Y, Z. First partner feels like, not understood. So they get even more upset. Like they feel invalidated. And then there's like a huge blowout fight, which one person shouts at the other, you're not doing anything. You're not helping. And the other person's like, well, yeah, I am trying to. And then they shut down and they don't speak for a couple days. So there's, I've worked with a couple couples that have that general vibe, and I've also been there too, right? So, and so it's also, I feel like, oh my gosh, there's one couples therapist who told me, the soccer balls like you kick around as a couple, you'll kick around those same soccer balls for the rest of your marriage.
Yeah.
And I thought, oh God, I don't know like what I'm talking about. But it's kind of true. Like you as a couple, you do have these recurring issues that could feel like, here we go again. We're stuck in this same goddamn fight about the thing, and when I get upset, he does this and I do that, and then we don't talk for 2 days. And so it could kind of feel like you just have these patterns that feel unbroken, and they might always be there. You might always fight about that thing, but maybe you can learn to fight about that issue differently. So, for example, like decreased maladaptive emotion-driven behavior, as he said, like when some people get super stressed, they yell at the other person, or they scream attacks that that really burn, but we're like in the heat of the moment, but that other person holds on to that criticism, and like that'll just be a part of their memory of how that other partner feels about them, even though the partner goes, no, I was just really upset. I didn't mean that, right? Yeah. So it's like stopping stuff like that, or and learning how to say like, I'm angry, instead of like, you're a jerk who doesn't help me, right? And I love doing this in couples therapy as well as receiving it, but that what you said, like drawing out vulnerable emotion-based behaviors, it's really like getting to this, my supervisor said, like getting to the softness. It's instead of saying like going to the anger and to the push against each other, it's going to the common ground of like, I love you, I feel hurt, I want to give to you, but I also want to be recognized for the way I feel and my perspective of the situation. So the couples therapist should eventually guide the parties to that point, right? To share those vulnerable emotions, the softness, the hurt, and the love underlying all these kind of problematic patterns.
Yeah, I'm just imagining two armadillos sitting there in couples therapy with like all their armor on, and they're all mad and like, they're all hardened, and then the therapist's job is to get to the soft underbelly.
Yeah. It's like the porcupines, and then you get the little soft bellies. Yeah, exactly. So exactly. And there's like such beautiful moments where I've seen couples like fight and get teary, and they look at me for like, they look at me with this desperation of like, please understand, like, please help, please understand. And you could see the spines, right? You could see the hard shells bashing against each other. And then when you guide them to like, what were you actually feeling? What was like, give me the hurt, basically. I asked different questions that get there. Like, did you feel hurt during that fight? Or, what do you want from that other person? Like, do you care about them, right? To get those moments. And then you see a break where they go, yeah, like I just was really hurt, and I want that other person to understand that I love them. And then the other person hears that, and you kind of guide the couple to really take in those moments, right? Like, especially when they're upset, if those vulnerable moments come out, but the other person still has their like hard shell, right? You guide them to be like, partner X, did you hear what that other person said? And then you kind of coax that out of them to get to a place of connection. And it's just so sweet. I've seen such amazing moments where it's like, oh, I didn't realize you felt that way, and I love you too. And then you reconnect on the points that brought them together in the first place. So sometimes it's like the most rewarding thing when you see that. It's amazing.
I can't wait. This has been the therapy I've been so excited to do since just deciding I wanted to be a therapist in the first place. So
it's not easy though. As a therapist, I mean, if you go into couples therapy, like keep this in mind, because of the poor therapist. If the two parties are fighting, right? Like you and I are getting used to doing individuals therapy. So making that relationship with that person, working through emotions together, kind of like making a unit, you and that one person. But with a couple, they already have something going on, right? You're just kind of coming into a party that's already been going. And if there's a fight or there's a certain kind of energy, it takes training for us to be able to like navigate through that, right? To like stop them from fighting if they're just screaming at each other, or trying to get them back to baseline or back to the topic at hand, or, you know, it's way more to work with, especially over Zoom, right? Because they're usually in the same room and you're like on a screen, and your influence is basically like minuscule compared to their fights. So yeah, so it's just
cool my couples therapy was done over Zoom, and I really didn't like that aspect at all.
What didn't you like about it?
I didn't like being stuck on the other side of the screen with my partner, who I'm very angry with and who's very angry with me, and the therapist is all the way over there in this small screen, and that once it's over, we just shut our laptops and we're just left with each other sitting on the couch. You know what I mean? Yeah.
That's the hard part of the Zoom world in general, right? Because it's like we're not taken to a new context, a new place to kind of, you know, just have a different world, right? You're like in your world, exactly. All this stuff.
I know. It would have felt more safe, I think, to go to some different place, go to a room, and that room can kind of hold the hurt and the fighting, and then our house can, not that it was much of a sanctuary back then, we had a rough first year, but it wouldn't just be like a bomb dropped in our own home every Wednesday whenever we went.
Yeah. I think that's the hard part about couples therapy too. A lot of the time people, you know, couples kind of avoid, like they don't want to get into the fight, so they kind of push things down and avoid until you get to couples therapy, and then you stop avoiding, you like release all of the emotions and the pain and revisit old wounds, and it could be intense, and it could be hard to work through.
What would you say to a couple who's afraid to seek couples therapy because they don't want that weekly disruption? Like, you know, maybe their relationship is struggling, but when there are moments of peace, it's really hard to want to go and disrupt that.
Yeah, I would say it's kind of like the way we talk to our individual therapy patients about it. It's like, if you want a pattern to get better, it's going to feel worse while we're working on it, right? Instead of avoiding our problems, we're actually going to address them. So that's going to bring up old pain. But that might be just what we need to do in order to work through them in a healthy way and not just kind of have them stall, right? So, but yeah, we all of our therapies, we say that up front. It's like, therapy is not here just to make you feel happy and pleased and content. There's times that are very, very hard that are necessary.
Do you have any advice for that couple, you know, once the therapy session is over? Like, do they continue to fight it out? Do they hug it out? Like anything? Yeah,
I mean, if you can, if you have a good session where you wrap it up with on the vulnerable, nice, connected moment, that is just gold, right? It's like, yes. But if they don't, which happens quite a bit, I mean, especially in the cognitive behavioral therapy tradition, you give them homework. So I think most couples therapies do kind of give some kind of assignment to the couple, so they work on something in the meantime, like work on validating the other person's emotions instead of giving advice, or work on just like taking a 20-minute break, you know, so you could cool off, so you're not in a heated place. Or another favorite one was plan a time for you and the other partner to just like have a powwow where you work out things together, right? Because it's interesting. We do that with every other kind of relationship we have. Every other professional relationship, you define your terms, define your goals, work through issues, have meetings where we like review the progress, right? But we don't do that in marriage or a relationship. We kind of think that happens naturally, but they're actually they're actually communication and partnership skills to be applied in relationships too, that you could learn. So it's like really about like learning those skills on their own outside the therapy session.
Yeah. I just want to take a moment to read a follower story. because she talks about her very positive experience in couples therapy. She says, I grew up in an emotionally abusive household where I wasn't allowed to express my feelings. And he grew up in a family that discussed things openly, but completely devoid of emotion. That's resulted in two completely different communication styles, and we've struggled to reconcile that. Our therapist understands the way both of us communicate and has been able to help us push past our communication barriers. She's helped us identify what we each need to feel heard and validated, and taught us how to do that on our own outside of sessions. Through the course of understanding how to communicate, we've unraveled deeper conversations about what we both need out of a partner. It's been about 9 months since we started therapy, and our relationship has grown so much more productively in that time than it had in the previous 10 years. She says, yeah, it's great.
That's lovely.
Well, you can see the kind of prongs at work. I mean, obviously there was a big emphasis on communication, and it sounds like, drawing out that vulnerable emotion-based behavior was in there too. I mean, for one thing, like their communication patterns may have been emotionally driven, or because, she's talking about having grown up in an emotionally abusive household. So her experience with expressing emotions is obviously fraught. And he had a completely opposite, it sounds like, upbringing. So just learning like how to change for the betterment of the couple itself and be a team there, it sounds, was really successful.
Yeah, that's cool. That it's a cool example of what we were talking about before, where it's like two people coming in with their baggage, right, with all their learning history, and then the combination, right? It could be seamless, but sometimes, like, yeah, the two parties have learned to work through stress and conflict differently, and then how do you come together to like make your own way of communicating around those things?
Yeah. I asked if she felt like the therapist was ever taking one side over the other. She said it was always balanced. The reason I say that is because she basically just helps us have conversations. If we get stuck, she'll jump in and help us get back on track. She'll chime in to make sure she's understanding correctly, or if she hears something she wants to dive into more. We often end up having focused individual time during the session to help one of us unpack why we're feeling the way we are about an event. For example, my husband was really upset about a comment I made one day because it made him feel inadequate. When we talked about that moment in therapy, she lasered in on that for a bit to find out where that feeling of inadequacy stemmed from. She pointed out to him that I never said anything along those lines and helped him see he was projecting his own insecurities onto something I'd said. She never tells us we're wrong, just helps us see things a different way.
That's so cool. It's also so cool that a part of couples therapy is kind of clarifying the different interpretations of the same thing, and you don't realize how much of a fight, or even just like maybe your dynamics in general, are like a lot of us filling in the gaps, right?
Yeah.
Like a lot of, if someone shuts down and walks away, in your mind it could be that person hates me and wants to break up with me, and then you make a whole story out of it, but really that person just gets overwhelmed and needs some time to themselves, right? There's so much that we fill in with our own interpretations that some
Right.
couples therapy is like, wait, oh, she never said that, or he never said he didn't love you, just clarifying like what's in your head versus like what the communication actually is.
Yeah, Paul and I used to have a huge problem with that. I came in with kind of an avoidant attachment style. He came in being more anxious. And then we started that whole chase withdraw cycle that you were talking about earlier, where the more avoidant I was, the more he wanted from me. It was like, I have to get more of her. I have to ease my own anxiety. And then the more he would chase me, the more I'd withdraw. And then this would end up in a huge fight. So that was definitely something where, like, he had to learn to step back a little bit. And honestly, we had couples therapy, but I think you also kind of performed in a, in a very casual, friendly way, like maybe even a more effective form of couples therapy for us. But yeah, he had to learn to step back, but he also needed to learn how to ask for like what would make him feel more secure. And then I had to be willing to give that, or try to get closer to that. So communicating more, if I was going to be out, like how long, and that I loved him, and just maybe being like more affectionate at different times. And then he needed to learn how to relax.
Yeah, so, as your informal couple therapist, yeah, you're right. This happens so much where a lot of things that you do naturally, he interpreted as that you didn't love him,
right?
Even if it's like you didn't remember to hang up a towel or something. It was like, if she really cared about me, she would do it. And most of my interventions was just yelling at him that you actually do love him. That was like most to get him to stop. And so like, she actually does love you, so stop it. So that was my professional intervention.
Well, it just goes to show too how much I think what we got stuck in too was that we were coming at this from individual places. Like, yeah, the example from this past weekend though of that decreasing maladaptive emotion-driven behavior and drawing out the vulnerable emotion-based behaviors. I was at a wedding in my college town, and I was touring Paul around the campus, and I was telling him about a streaking tradition where people streak from like one end of the lawn to another. And he was just like not excited at all and seemed kind of judgmental, and it just like threw us back into this old pattern. And me filling in the blanks, I was like, why can't you be excited about something that I'm excited about? Like, why are you making this about you being tired and hot? What, like, are you shaming me for like streaking, or like, college age kids for streaking? Like, what is going on? So I'm getting really pissed off, and he's getting pissed off. And then suddenly it's actually, when I was in college, I was extraordinarily depressed, lonely, sitting next to the door because I had panic disorder. And so all of my memories about college are extremely negative. And so being in this place is actually hard for me, which is a completely different story than what I had written in my head. So it's just, I think like when we get stuck not sharing our vulnerabilities, then that's just breeding ground for false stories to come up about why we're behaving the way we are.
Yeah. It makes me think about, I mean, it's kind of related to what you're saying, but it makes me think about how a lot of people can come to couples therapy, not just for what you're talking about of like this day-to-day in the present moment, how do we communicate around stress and feeling vulnerable and sad, but also if something bad happened in the past, like if one partner cheated on the other, right? There's like present communication around an ongoing communication and patterns around that, but sometimes it could just be like about a past transgression or a trauma or something that the couple went through. And that I think is especially hard because there might be a lot of legitimate pain and hurt and betrayal or all the sorts of things, but you have to decide what you want to do moving forward. Do you want to punish that other person forever? Do you want to or learn to forgive, right? So there's just a lot of interesting dynamics around when there's something that's like a wound, an actual wound in the relationship.
Have you ever had the experience of being personally upset or judgmental towards a partner for something that they did? Like, I think a big example would be couples therapists who are working with a partner who cheated, and then maybe that's something that happened to the therapist in their past, and so it's really hard to kind of work with that. Like, have you had that experience?
I mean, personally, that's something that I struggle with my now ex-husband, but he didn't fulfill certain agreements of contributing in certain ways to our. This is my perspective, of course, one person's perspective, but he wasn't honest or like didn't fulfill certain agreements that we had. And certain expectations. And so for me, that felt like this huge betrayal, right? And part of it was hard because there were elements of it that kept happening. Like he kept doing that in smaller ways. But it was hard for me to get over that initial transgression. Like I held on to it and held on to the anger. And it was really hard for me to learn to like forgive him and let go and start afresh in a way, instead of just keep bringing up that old anger whenever something like that reminded me of that transgression. So I really had to decide at some point, like, do I want to hold on to this anger and how is it helpful and what would I need to heal from it? Or like, do I want to forgive let go and work together on building this relationship, right? Like as an individual, I wanted to stay angry. As a partner in a couple, I had to learn to like accept it to a degree and really communicate around what I needed moving forward. So no major solutions, just I remember how difficult it was, and even it was just helpful even just to talk to a third party about it, right? Like when you are in your world, couple world, you talk back and go volley back and forth in your own ways and the same fights and the same responses. But even just turning to face another person, explaining your side to another person, you end up just saying different things, right? And that did help a lot, but it is hard. It is not easy.
Yeah, I also think one thing that can be helpful in couples therapy is that when you go and you start telling your story, you realize how much of it has become a story. Like the same speech that you rehearse to the couples therapist might be the one you tell your friends and family. And that can just become kind of entrenched. And I think it would be helpful to kind of shake that story up and see, is this story like as calcified as it seems to be? Is there something in this story that is undermining the partner or the relationship, and that other people are then hearing, and maybe you're not getting the support you really need from your friends and family because they're thinking about you as this individual instead of as this dyad. I don't know. I just...
Yeah. And then you're bringing up a really good example of the cognitive part of cognitive behavioral therapy, right? Like, what do I believe about myself and this other person, right? Yeah. Even just stories of like, he did this because he doesn't love me, right? That's a story that might actually, that we might hold on to and react to, but that may not be true, right? That may not actually reflect how that other person is feeling. And so it's like reworking that belief, like really evaluating it, looking at it, see how it's helpful or not helpful. Even just turning to another person and sharing our individual experiences, I feel, or individual interpretations and stories, I did feel like it was helpful in getting us to that vulnerable place, because when you, at least for me, when I was in those patterns of fighting, it was mostly focused on the other person, what they did wrong, and like it was really anger driven. But when I could talk to someone else, I was able to get to those, like I was really hurt because I felt like when he didn't live up to those expectations, it felt like he didn't care enough, right? And so I could get there and start to get to that like more vulnerable place of hurt. And then that led to a different set of like emotions and reactions from him than when I got angry. Yeah. When I got angry, he would withdraw and just kind of, okay, I'll do it. But then he was able to get to other places of like shame or hurt or guilt or sadness in himself, right? So I just thought couples therapy was like super, and it was at a point where we were having trouble, but leading up to marriage. So I really did want to get engaged in couples therapy just to like, how do we work through our old issues in the context of like about to make a bigger commitment in our relationship. And I just thought I recommend that to a lot of people, like getting married or committing, just like go to couples therapy just to like learn about each other. You're entering in a partnership, right? If you were to enter in a partnership for a business, you would do something similar, right? Working out like goals and values and approaches, right? Well, we have this, I'm not going to pretend to know a lot about this, but that's a tradition in Christian marriages, right? You go to pre-marriage counseling, and I think that's a great way to look at couples therapy instead of let's save something that is broken. And that's also, anytime is good to go, I guess. But you don't have to wait that long. It could be, let's go because we want to know how to strengthen this commitment we're about to make. We want to make sure that we are as well equipped as possible for this next step in our relationship. Yeah. I'll give a little rundown on just the couple therapies that I know of. If you go to a couples therapist, it's the same thing with all kind of therapy. It's good if they were trained in evidence-based therapies. Cognitive behavioral therapies are really helpful. It really is also like the fit if you like the therapist. But the two therapies I've been most exposed to in my training has been one of the main ones is integrative behavioral couple therapy, IBCT. And that's a cool one. It's the same kind of like split into the assessment and treatment process. And it's really behavioral, which means that you're really focused on the communication and like what you do to each other and with each other, what you say and how do you understand each other. And so it's the same thing. You start out with a joint session and then an individual session with the partners, and then a feedback session where you talk about like what are the problems, what are the barriers, what are the problematic patterns of behavior and communication, and then how do we work on it with skills. And then when you work on it together, you just work on like in the moment, how do we talk to each other? How are we communicating love? How do we work through stress? So it's very skills-based, which I love. The developers of that is named Dr. Andrew Christensen, and along with Dr. Neil Jacobson. So those are the two developers of IBCT. The other one that's really cool is emotion-focused therapy. I would love to do it and I really want emotion. I really want to go to this kind of therapist. So I just might. But that's actually, it's really, listen, once you hear the description, you know why I love it. So it's attachment focused. And it's based on the idea that a couple is kind of like you're attaching to a caregiver, right? So it's like you need this relationship for nurturing, soothing, and protection, right? During times of stress, and you're a family. And so EFT, emotion focused therapy, is about like really understanding the emotional underpinnings of everything, like learning how to be open and attentive and responsive to the other person's vulnerabilities and emotions. So I love that. I really want to get training in it. The developer of that is Dr. Johnson. So it's a very, very cool kind of therapy.
Awesome. One last point I wanted to bring up was some people seek couples therapy when they have what seems like an individual diagnosis. So one partner might have depression. And why I said it seems like an individual, it is an individual diagnosis, but at the same time, it's heavily impacting the partnership. And that's obviously kind of the theme of our podcast. So I just wanted to make this point. There are meta-analyses that have showed that in these cases, if one partner's mental health difficulties are creating distress, like significant distress in the relationship, couples therapy can be as effective as individual therapy for treating that disorder. Yeah. And so, I mean, and it makes some sense if you think about depression. Struggling in your relationships is a huge risk factor for depression. So if you're able to strengthen the kind of core relationship in that person's life, then the depression is going to be alleviated somewhat as well. And it also works because what you often find is that a mental health disorder will be made worse by the partner's reactions to it. And that might be the partner kind of allowing the symptoms to... They might like allow their other partner's avoidance symptoms to strengthen. For instance, somebody with agoraphobia never wants to leave the house, so their partner might go out and buy all the groceries all the time and start doing everything. And so that person with agoraphobia, then that agoraphobia strengthens because they've got someone they can rely on to take all their challenges away. If a person with depression, if you're a mom and all you want to do is lie in bed all day and then your father takes over the childcare duties, then suddenly, it's even easier to stay in bed. So I know an example of a husband and wife who were both doctors and one was an alcoholic. And so when the alcoholic would drink, the husband would take over their call. They'd go into work for them. So that's a big example of... Yeah,
that goes into like the enabling codependency episode.
Exactly.
Yeah, interesting.
Yeah, so in some cases, couples therapy can really be what majorly helps alleviate these symptoms, because you stop those behaviors.
I love that. I love that you said that. I mean, that's just so, that speaks to the frustration I had that led to us wanting to do this podcast. Because if we're doing individual therapy and we're working with that one person, we can work with that one person, but there's just so much in that person's life that contributes to their depression or whatever anxiety, mental health issues they have. And there's so many times as a therapist, I would just want to work on the environment, right? Like work on the way the parent talks to the kid, or way the partner talk, or like how their colleagues talk to them, right? There's just so much about the social role that makes or breaks mental health. And that's really interesting to know that there is science showing that if you work on the relationship, the individual diagnosis could get better.
Mm-hmm. Yeah, it's the same argument for family therapy. So.
Yeah, I mean, I think this is all to say that, if you are even thinking about couples therapy, but may not be in a place where it's like, breaking up or something really severe, I recommend just going to find a couples therapist. Just try it out. If not, there's a lot of other, there's some home resources that you can look into. There's two books that we'll recommend. One is by the developer of emotion-focused therapy. It's called Hold Me Tight, Your Guide to the Most Successful Approach to Building Loving Relationships by Dr. Sue Johnson. That's a good one. So the other book I wanted to recommend was written by the developers of Integrative Behavioral Couple Therapy by Andrew Christensen, Brian Doss, and Neil Jacobson. So it's called Reconcilable Differences: Rebuild Your Relationship by Rediscovering the Partner You Love Without Losing Yourself. So that's a really nice one too. I mean, you're a big fan too of Esther Perel's podcast and all of her resources. She's like the relationship marriage guru.
I think that's a good podcast to listen to a really talented couples therapist do good work and see what it could be like being in couples therapy. I also thought couples therapy on Hulu was excellent. A really great therapist. Yeah, and then you can see it on the screen. Oh, it's so good. Cool. Yeah. So those are kind of maybe more fun resources, but I actually find them helpful because I think when you are in a partnership and your fights can feel really rigid, even just hearing another couple dive into those same rigid fights and narratives and discover the vulnerable emotion-based behaviors that might be adaptive to share, that prong we were talking about, it can maybe open your mind to what might be going on in your own relationship. And perhaps even give you some tips on how to talk to your partner a bit differently. And I think that's exactly what we're going to talk about next episode, is common relationship dynamics and patterns that have been showing up repeatedly that are either helpful or unhelpful to the relationship, and some tools for overcoming that. So we hope you will join us next episode. And as always, we hope that you will rate, review, subscribe, and leave us lovely comments on iTunes. And we'll see you next week. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.